Thank you for joining me today on the City Builders podcast. I have the pleasure of talking with Sam Itani, the CEO of Shasta Regional Medical Center, and I'm really excited about today. You have a really fascinating story that we're going to talk about. We're going to talk about how you got here, how you got to Reading, what opportunities and strengths Shasta Regional Medical Center has. We'll talk about the medical school, some of the things that we can see as opportunities for growth, and the future of Shasta County and healthcare, which is so important to our community. So thank you so much for being here today.
Well, thank you for having me on the show. I really appreciate that.
Awesome.
Also, thank you for allowing me and giving me the opportunity to highlight what Shasta Regional Medical Center is all about and how we could serve our community.
Welcome to the City Builders podcast, brought to you by the Reading Chamber of Commerce. I'm Todd Jones, President and CEO. In each episode, we bring you insights from local business leaders, tackle important issues, and explore what's shaping the future of Reading. Whether you're a business owner or just interested in our community's growth, this podcast has something for you. Thanks for joining us. The City Builders podcast is brought to you by Obsidian IT. Obsidian IT is a Reading-based, employee-owned technology company providing simple, scalable, outsourced IT for your business. Discover how Obsidian cares about IT and give them a call at 530-242-6000 or obsidianit.com. Obsidian keeps us running at the Chamber, and we could not do business without them. Well, thanks for being with me today on the City Builders podcast, the first one of 2026, and I'm really excited to have you here. I met you early on when you first came to Reading. We're somewhat within the first month or so. You've been here just over 2 years. Is that correct?
It hasn't been 2 years yet. It's a year and a half.
Year and a half, okay.
Year and a half. Yeah, times fly.
Yeah.
Times fly.
Time flies when you're having fun.
I do. I'm having a blast.
That's good, because healthcare is not always the most fun thing to do.
Well, when you've done it all your career, it becomes routine. So I'll make the best of it.
That's great. So before we talk about Shasta Regional Medical Center and healthcare in the North State and all the things, there's a lot of conversations about healthcare going on in Reading and Shasta County right now. Let's tell everybody, because part of the podcast is really to get to know some of the community leaders. And you're a community leader. You run a very important organization that takes care of hundreds of people every single day. So tell us about yourself. Where are you from? How did you get to Reading?
Wow, that's a long journey.
It's a big question.
It's a long journey.
Give us a summary. But you have some high points there, maybe low points, but certainly important points about how you got here.
So to answer your first question, where I'm from, I was born and raised in Beirut, Lebanon, and I grew up during the Civil War. When the war broke up, I was 9 years old. So all my childhood was during the war. No water, no power. School was on and off depending on how intense the war is. It was a challenge.
Wow.
My dad has to leave the country to earn some money to keep feeding us. I was left to take care of the family when I was a child. So it was upon me to go out and get the water, get the food.
Wow.
We don't live in single family houses. It's like apartment buildings. So you have to hold the water. We used to live on the 4th story.
Oh, my goodness.
So you have to carry all the buckets of water, and we fill every pot we have in the house. We fill the tub.
Do you get the water from like a well?
Either well or they truck the water, and you have to wait in line to get your share of the water. Same thing with the food and the bread. One day they'll give you like a ticket, and the next day you go in to cash it for bread. So you have to wait in line. And,
oh, my gosh.
So if you didn't get there soon enough, you get no bread or no food. So it was a challenging childhood.
Yeah.
But throughout all, like they say, what doesn't break you, make you stronger. So when people ask, what do you want to do when you grow up? Our goal was to survive the next day.
Yeah.
Right? But we're blessed. I feel I'm very blessed to be able to make it through a life, number one. And number two, to be able to sit in front of you having that conversation.
Yeah. I'm glad you're here. I'm glad you made it through all that. So how did you end up leaving? What was the impetus to leave Lebanon? I mean, that's your home country. I'm sure all of your family and friends there. Tell us about that journey, growing up in the Civil War.
I mean, I never intended to leave. I always wanted to stay. But given the war and the lack of schools open all the time, I thought about coming to the U.S. to go to school. But to do that, you have to learn English because, as I said, in Lebanon, our native language is Arabic. The second language of the country is French. But Lebanon used to be a French colony. So when I went to school, I learned Arabic and French. So when I graduated high school, I didn't know any English. So I had to study English before I could come to the United States to study. My dad was opposed to the idea because my brother already have left. So I was the only son left, and in our culture, you'd like to have your son next to you.
Sure.
So I started taking classes at the American University of Beirut, English classes. And while I was there, a fight broke out and gun and bullets flying, and one of the bullets ended up in my arm.
Wow.
I was lucky I had my arm in the right place, but it ended up in my chest. I didn't even feel it, to be honest with you. My friends told me, you're bleeding. Wow. So luckily, I was able to go to the hospital, wait in term. Of course, the hospital was full of worse injuries than mine.
Sure.
Over there's no... the healthcare was all in shambles because of war. So one way or the other, they managed to get the bullet out and mandated and said, okay, good luck. Wow. Yeah, came home. My dad saw me in that condition and said, okay, you're leaving.
Yeah.
He changed his mind.
How old were you when that all happened?
18.
Okay.
I was 18 years old.
So it was about you were going to do something. Some fork in the road was going to happen there, and that was it. And it was just a stray bullet. You weren't targeted.
No, I wasn't targeted.
It came up through. You were in like a library or study hall or something.
I was in the study hall at the university, and I was standing by talking to my friends, and then of course one of those bullets that ended up, mistakenly hit me. I had nothing to do with it. So that changed his mind and said, okay, you're leaving. I'd rather lose you leaving the country than put you in a body bag. So. When that happened, I started seeking scholarships because, financially, I couldn't afford to come to the U.S. and pay what it cost to go to school back then as a foreign student. So luckily, I was able to secure a scholarship and got accepted. Honestly, I got to multiple universities in the U.S., but I chose to go to Colorado because I wanted to go to biomedical engineering.
Okay. And Colorado, that's a big difference from Lebanon.
Oh, yeah. Huge. Well, you only know so much about it. Back then, the internet wasn't big. You could go do your research online. But it wasn't existent. And even if it did, we didn't have powers, we didn't have computers, or nothing like that. So you have to rely on whatever published and some pictures and some marketing that the schools will put out. So I went to Colorado for my undergrad. Yeah.
Where at in Colorado were you?
I started in Denver because I had to take more English classes because after I got shot, I didn't go back to that school.
Right.
So the university required that I passed an English test, called Test of English as a Foreign Language, like a TOEFL test. I have to score like 500 or higher to start my academic school. So my first stop was in Denver, University of Denver. So I took English classes there for a semester, and I passed the test. And I don't remember what I got, but I passed it. And I was able to start my academic schools. But I transferred to Colorado Springs. Okay. It was more affordable. Yeah. Again, I was on a tight budget. So Colorado Springs back then wasn't what it is today. And I was going to school there, and I managed to get both my bachelor degrees from Colorado.
Oh, great. And so you got your degrees in biomedical engineering?
Yeah, one in biomedical engineering. The other one is in electronic engineering.
Okay.
And then I went to Pittsburgh, Kansas to get my master's degree.
Oh, okay. What school is in Pittsburgh, Kansas? It's not K-State, is it? That's in Topeka, I believe.
No, actually, the school's at Pittsburgh State University.
Pittsburgh State, in Kansas.
Yes.
Not Pittsburgh, Pennsylvania.
No, in Kansas.
Yeah, okay.
Again, budget is an issue.
Sure.
So you got to look at a school not only that accepts you, but you can afford to live in as well.
Okay. So went to Kansas, got a master's degree there.
Yes.
And then you've been in healthcare your entire life. And what were you working on before you got into administration primarily?
Well, when I graduated, I had all the intentions to going back because I was on a student visa, right? And so
go back to Lebanon.
To go back to Lebanon. That's always been my intention to come back, seek education, go back home, and use my knowledge to help technically rebuilding the country because it was completely destroyed. Unfortunately, the civil war is still raging. Airport was closed. No American airline or foreign airline would fly to Lebanon. So I have no way to get back to Lebanon.
Wow.
Unfortunately, my visa here expired, so I had no legal status to stay. So I was really left, with no country to go to.
Wow.
No place to stay. Luckily, I was able to get into Canada. From the U.S., I went back to Canada.
Okay.
Stayed there for 9 years. While I was there, I was able to get my Canadian citizenship. But I taught at Mount Royal University.
Okay.
So teaching there. And then I found my way working for Foothills Medical Center in Calgary, Alberta.
Okay.
It's a huge hospital. It's a 1,100 bed facility connected to the University of Calgary. So I was able to work on some of the research they were doing. But then my brother was in the U.S. and kept telling me, you need to come back. You need to come back.
Yeah.
You need to come back. So luckily, through the NAFTA agreement, I was able to secure a TN visa because I got a job with Adventist Health in Bakersfield.
Ah.
I applied for multiple jobs. I get rejected so many times because I didn't have a green card or a citizenship.
Someone had to sponsor you.
Correct.
To come back.
Correct.
Oh, interesting.
Fortunately, Adventist Health was willing to do that. And through the NAFTA agreement, I got my TN visa. And I came start working with Adventist Health in Bakersfield.
Wow.
Yeah, this was back in 1998.
Okay. And so started working there, and then you eventually worked your way up into hospital administration.
Correct.
With
Yeah.
all of your technical degrees, now you're an administrator.
Yes. I started working in the biomed department, believe it or not. And for those who don't know what biomed department in the hospital is, we're responsible for servicing, maintaining, installing, acquiring medical equipment, from your thermometers to your IV pump to your ultrasound, CT scan, or whatever. Any piece of equipment is managed by the biomed department. So it was my job.
Wow.
So my first job with Adventist Health was a biomed tech on the bench fixing equipment.
Wow. Do you think you could still do it now? If you want, you can go down to your department at Shasta Regional and, hey guys, I know what to do here. Oversee a little bit of repairs.
I know enough to be dangerous because technology has changed big time since I transitioned to the C-suite. But I understand the concept, of course, and I understand the ins and out of it.
Yeah.
Even though technology changed, things have changed, but the concepts are still the same.
What do you like more, biomedical tech or CEO?
It's a tough question, but to be honest with you, sometimes I wish I was still in biomed. It's so much easier to work with a piece of equipment. It doesn't fight back and doesn't talk back.
Yeah.
It lets you do whatever you want to do to it. And then,
there's no labor negotiations with biomedical tech.
None.
Yeah.
None. So, and at the end of the day, when you fix it, you get the joy to see it up and running again. Right?
That's great.
So you could see the fruit of your labor right away.
That's awesome. So where did you come from before coming to Reading? What community were you in?
I was down in Corona.
Okay.
And then down in Riverside County. I was the CEO at Corona Regional Medical Center.
Okay.
I was the CEO there for 3.5 years.
Is that within the same system as Shasta Regional?
No.
Okay.
It's with Universal Health System. It's UHS.
Okay.
It's a national company, for-profit organization.
And you've been in Reading for about 1.5 years. So how do you like Reading? Besides, we'll get back into some of the medical stuff, but how do you like Reading?
Oh, I love Reading. I mean, honestly, the way I chose to come here. It's not like I had to come here. I had a conversation with Dr. Reddy, who is the owner of Prime Healthcare. He brought, to be honest with you, I wasn't sure what Shasta Regional was. We were talking, and he mentioned to me, hey, there's a hospital at Shasta that we could use your help turn it around, and because it's struggling. And I asked him, well, where is Shasta? Honestly. He said, well, it's in God's country.
Yeah.
How he described it. I said, great, where is God country in this case? So he started telling me where it is. And I wasn't so sure because I lived in Southern California through my time. Friends are there, families are there, my wife's business is there, my kids are there. So it's like, He said, why don't you go there? I'm going to get you an airline ticket, just go in there, spend a couple of days, and come back and tell me what you think. When I was there, his assistant just booked me a flight, and here I was on my way to Reading.
Wow.
So I drove from Sacramento to Reading, admiring the drive. It's a beautiful drive, and most of it is boring, to be honest with you.
Yeah, if you do it many times, like many of us do.
Yeah, it gets boring. But when I got there, I was like, wow. I liked the first impression for Reading. I mean, I love country.
Yeah.
I love trails. I love hiking. I love walking. So to me, it appealed to me right away, my first impression. And then I got to the hospital and I started talking to people. The people are amazing. Mm-hmm. We have a great, great team. I mean, I didn't know them. They didn't know me.
You're right.
They're so welcoming. They didn't know why I was there, honestly. When I got there the first 3 days, they have no idea who I was.
I'm sure.
And why I was there.
Right.
They didn't know. Right. So they were very transparent. They were warm, easy to communicate with, and very direct about some of the challenges, the issues we're having at the hospital. And when I went out to the community, I started talking to people. I go eat out, talk to the waiter, talk to people sitting next to me about what do you think about the different hospitals in town, about the healthcare in general, right? And people were so warm and willing to have a conversation with a stranger.
Yeah, that's great.
Which is, I tell you, in Southern California, that's not very common.
Yeah, it's something that makes Reading special for sure.
So it's really show its character. And I love that. I love the people. I mean, we're in the business. It's all about the people.
Sure.
And I love that. So I love the community. I love the people. I love the area. Yes, to be honest with you, some of my concern was the hospital. To be honest with you, there was a lot of challenges. Some of the reputation in the community wasn't what I was really hoping. But I guess that's why Dr. Reddy wants me to come here.
Yeah.
So after spending 3 days here, I went back and met with Dr. Reddy, and he didn't take no for an answer.
Wow.
So here I am.
Here you are. That's great. Well, we're glad you're here. So maybe tell us a little bit about some of the, strengths and maybe some of the opportunities as well with Shasta Regional. What do you see as really the bright spots of Shasta Regional? And if you want to, we can talk a little bit about, some of the things that you're still working on and some of the opportunities you see.
I mean, Reading in general and Shasta County and North State has a lot of opportunities. I mean, there's a lot of untapped resources there and untapped possibilities to really enhance the healthcare overall. And hopefully later on, we'll talk a little bit more about that. But there's a lot of potential for Shasta Regional Medical Center, given its location, given how many acute care facilities are in the North State. Shasta Regional plays a huge role in providing a compassionate quality care in this community. And unfortunately, we're not taking advantage of what Shasta Regional is capable of providing. There's a lack of beds in the community. However, we have more beds in our hospital that we can open and make available to the community.
That's good.
So we have the ability to grow.
I mean, I always think about you guys, you have a great marketing team, because I always think about Shasta Regional. I think about Heart Health. It's Heart Month while we're recording this. It might come out at the tail end, but Heart Health is a big part of what you guys focus on.
Correct.
I guess maybe how did Shasta Regional try to become that place that people think about for heart health?
Well, if you look in the North State, Shasta Regional, and I say that with a lot of modesty, is probably the only hospital that have a comprehensive cardiac care program from A to Z. Starting with our chest pain center, we're the only accredited chest pain center in North State. And we're one of 27 in the whole state of California.
Wow.
So we have the chest pain, we have our cardiac rehab program. It's the only accredited cardiac rehab program in the area. I mean, that helps you after you are finished with hospitalization, you need to get some rehab. And I know there's a lot of other cardiac rehab, maybe a couple of other in the area, but we're the only accredited one in the area. We have a great pulmonary function lab. Again, we're the only accredited one. So again, we focus on quality. So it's not enough to have a service line. You need to have a quality service line. And this accreditation validates the quality of the program because you have a third party looking at your data, looking at your outcome, and evaluating it, and coming back and says, based on your outcome, we're going to accredit you and give you that certification. Otherwise, everybody would have it.
Sure.
So for us as a community, that's the why. That's why you need to watch for that. So for Shasta Regional Medical Center, our cardiac care program is the only comprehensive cardiac care in the region.
What are some other opportunities maybe for Shasta Regional Medical Center, kind of looking forward? Where do you see growth potential for Shasta Regional Medical Center and other opportunities?
I mean, one thing we're trying to work is and try to grow our medical group. In 2025, we recruited 3 primary care physicians.
Oh, that's great. That's great for everybody in the North State.
Absolutely. So we have 2 of them stationed on campus in our medical group building. And we have Dr. Kumar is down in Anderson. She's a female provider. And we are accepting new patients. So for those who doesn't have a PCP and they're looking for a doctor, we are accepting new patients in both locations.
Okay. And that's you have your main one right across from the hospital, right across the Hamus Street, correct?
That's correct.
That's your medical group.
That's our medical group, yes. And of course, we have a clinic down in Anderson.
Okay.
And we're looking to add one more clinic in the future in Palisadro.
Oh, that's great.
As well. So we're continuing to recruit more primary care physicians. We're also growing our residency program. We have an internal medicine residency program. We currently have 24 residents.
Wow.
We passed our accreditation with flying colors, and because of that, we were approved to increase it up to 42 residents.
42. How quickly could you get to 42 residents?
Every year, we're going to add 6 more. So,
Okay.
So in this next class that's coming in, instead of having 8, we'll have 14.
Oh, that's great.
And the year after it, we'll have 14, and then 14 is for the total 42.
And it's an internal medicine residency.
It's an internal medicine residency.
Wow.
And some of our graduating class this year, 6 of the 8 were accepted in fellowship programs,
Okay.
which speaks volume about the quality of the program.
What is your retention rate for the residency program to keep them in the North State? Maybe not just for you, but
Well, this
big
is a
problem.
great question, right? Because again, not only we're lacking primary care doctors, but we also need specialists. A lot of time we focus on PCPs, primary
Right.
care physicians.
Sure.
That everyone should have a doctor just to make sure we're maintaining our health. But if you need a specialist, you also need to focus on that. So our aim with our resident, hopefully after they finish their fellowship, to come back to Shasta Regional, whether they want to go into cardiology, whether they go into nephrology, any specialty they chose. We have a lack of all of those.
Right.
I don't think we have enough of any specialty. We could use more of those. So right now, if I look at my class, 6 of them are going to be going somewhere else to do their fellowship.
Which
Right.
that makes them a specialist. They're going into a
Right.
specialty program.
Correct.
That's why they go to the fellowship.
Correct.
I see.
Yeah. So hopefully when they finish, some of them are 1-year, 2-year fellowship program. Then when they finish, bring them back, not only because they are from here, because they are specialized
Right.
in certain specialty.
Right.
We have some going to cardiology, some going to nephrology, some going to GI, some going to sleep medicine. And we need all of that.
Right.
We really need all of that.
How do we get more specialists to Shasta County?
Well, that's $1 million question.
Yeah.
I mean, honestly, this is something that we all, that's what keeps me up at night, honestly. If somebody asks me what keeps me up at night is how we get more specialists into the North State overall, to Shasta County specifically. It's a challenging task. One, there's not enough specialists overall, not only here, but throughout.
Across the country.
Across the country, there's not enough to meet the need. It's that much challenging to bring into the North State. So we really have to be innovative in our thinking and our approaches on how we attract them
Right.
and retain them, right? And sometimes you have to think outside the box, and you and I chat a little bit about
Sure.
some of the ideas,
Yeah.
And we have to explore all options, honestly.
Right.
Shasta is a great place to come to, Shasta County. It has a lot of recreational stuff. It's like a vacation destination. And maybe we should tap into that.
Right.
And when we're recruiting, right? Maybe having permanent specialists long-term may not be attainable, but can we have rotating
specialists
Rotating
for
specialists.
a month at a time or 2 months at a time or whatever it takes.
You got to bring them in here.
Yeah.
You got to, and eventually 1 or 2 of them will like it enough
Right.
to stay.
Right.
But you got to get them in here first.
Right.
Get them fall in love with what we have to offer.
Yeah.
There's a great opportunities here. There's a lot to love, to be honest with you. I mean, I'm hooked. I love the area
Yeah.
here. I feel
Yeah.
at home. I feel at peace when I'm here.
That's good.
Yeah.
My very first podcast I did was with Dr. Jesse Curran, who is one of the owners of Prestige Urgent Care. And then they also have a Medicare clinic called Juniper. And we grew up together in Trinity County, just west of here. And our joke was we should just buy everybody a boat. You buy a wake setter if you're a physician, or we have a fleet of them. And if you come here for a month, you have access every night
Right.
to a wake boat on Shasta Lake. Maybe we buy them a houseboat too, and that's where you could stay on a houseboat, and then you just come into town, and then you're kind of on vacation partially, and then you come in and work your 8 to 10 hour day.
I don't know if you was joking about it or not.
It's kind of a joke, but hey, we're like, think outside the box, right?
You got to think outside the box. I mean,
right.
you gotta sell what assets you have here.
Yeah.
And our assets here is our recreation.
Outdoor recreation.
It's outdoor recreation. People travel, pay to come to Shasta, County to ski, to go, biking
Right.
trails,
Right.
Boating, fishing. People pay to come here. Well, guess what? Why can't we create something that attract people to come in here while they're vacationing? They can take care of our patients.
Yeah. Might as well.
You know?
I mean, there's so many other things that people are doing right now. You could just make a big village for people to come in and have all the amenities they need to enjoy Shasta County while they're here.
But that being said, we're still pursuing the traditional way of recruiting, and I know the whole community is talking about it. I mean, this is one area, to be honest with you, in other places I worked, nobody worried about how we're going to recruit physicians because there's no problem recruiting physicians. I mean, if you go to Southern California, it's not a problem. They're available. The biggest problem there is the traffic.
Right.
You know, sometimes to go see your specialist, you may have to drive half an hour, 45 minutes, even though it's only 4 or 5 miles.
Yeah.
Here's not a problem, the traffic, right? So you don't worry too much, where am I going to find a cardiologist? Where am I going to find an orthopedic surgeon?
They're all there.
They're all there. You just have to drive, a few minutes here or there to get them.
Yeah.
We don't have that luxury here. People are willing to drive 30 minutes to get to them.
Sure. They're not here.
But they're not here.
Yeah.
But what makes it great is the whole community is aware of that. Our elected officials are aware of that. They're all talking about it. They're all strategizing to find a solution to it. And that's what makes it at least a little bit positive on the positive side, that we are aware of the problem and we're working collectively together to find a solution and how we can solve it.
So what do you think of the idea for a medical school in Shasta County?
So it's
a broad question.
It is great that we have leaders, our elected officials, that are visionary, thinking big, and looking toward the future. It's always great. I mean, you always want your leaders to be strategic in nature and plan ahead and be innovative in their thinking, right? So bringing a medical school have a lot of positive. I mean, one, economic development is tremendous. Eventually, it will generate some physicians, but that's not a short-term solution.
Right.
I mean, I'm all for it. We should really spend time, really do a feasibility study to make sure that it could be done. We should not discredit the idea. We should dive deeper into it.
Sure.
And the two options, do we do it under Simpson University or UC Davis? I don't think it's an either or. The UC Davis solution could be more of an immediate solution where you can bring medical students and residents sooner while we are exploring or even building the medical school.
Right.
Because if everything goes well and you're able to come up with the money to build it, it's at least 10 years before you see the first resident coming out of it. I don't know that we can wait 10 years to solve our shortage of physicians. Because the problem in the next 10 years is going to get worse, not better, unless we recruit in between. So I think we should pursue the concept of exploring a medical school. And I strongly believe it's not an either or between UC Davis and the Simpson. I don't think the two contradict each other. I think one can be the founding blocks to the medical school. Because UC Davis is already in existence, the students are there, the residents are there. If and when we tend to work with them, you see an immediate impact compared to a medical school.
Okay. Yeah, that's good. That's good. Going back to recruiting a little bit, how do you see the recruitment efforts happening? There's several institutions in town that are all recruiting physicians to town. So how does that all work together? How does recruitment work to get a doctor here? Outside of our residents that we want to keep here, how do you get a doctor to come to Shasta County? What does that look like for Shasta Regional Medical Center to recruit a doctor? Are you guys, flying them out on a private plane and, putting them up in a really nice vacation rental, taking them to the best dinner in town? I mean, what does that look like for you?
I mean, we all try to impress them on the front end.
Sure.
But unfortunately, I've yet to see a physician who accepted a job because we flew them on a fancy plane.
Yeah.
Right? At the end of the day, they're going to look at their family condition, their spouse. Is the spouse willing to move? Because again, we don't want to recruit short term. If we're going to bring him permanently here, you don't want him to come for a year or two and then leave.
Right.
Because it makes it hard on the patient. They get established with their patient and they leave, and those patients left hanging. Who's going to take care of them now, right? So, I mean, we try as much as we can to roll the red carpet, try to impress them. But at the end of the day, when I came here, it's not how I got here. It's you look at the environment, you look at where you have to work, who you have to work with, what's the potential. I had to talk with my wife. It's like, okay, are we okay? Can we make that work?
Right.
And most physicians are in the same boat. They come in here, and depending on their family status, whether they're single or married or have kids, the rest of the family has a say, believe it or not. Otherwise, they may come and they're gonna start nagging, say, "Okay, I don't like it here.
Right.
I can't. Nothing for me to do."
Yeah.
Right. And then they push them to leave. So the key is to create an environment in which they can thrive and their family can thrive as well. And a lot of time we make a lot of concessions in the front end and we make it attractive.
Right.
But after it's been 2 years here, the thrill of the hunt is gone and reality strike. And they say, wait a second, I was expecting this, I was expecting that, and that didn't happen. So they pack and leave. And then we're back to square one.
What do you think is that biggest reason that people leave? Or maybe they don't come here at all, but really that retention issue is a big one to keep physicians here. I mean, honest question here. Why do you think they leave?
I mean, there are multiple. I don't think there's one main reason why they leave. I mean, we talked about it, family, right? What's the spouse is going to do? The spouse, what their spouse is going to do, or where she's going to spend her time or his time, depending if it's male or female. The kids, do they have kids? What sports are they in? What clubs are they associated with? And do we offer that? So that's part of it. And the other part of it is a financial part, right? Given the shortage of physicians in multiple communities, there'd be like a bidding war. You offer him $1, somebody offer him $1.50, and then at some point, based on the economics, you can't keep going up. It's not like an auction, right? However, because of the shortage, they can make more money. I mean, I had a doctor who went to Alaska. Make twice the money he's making here, but you have to live in Alaska, right? I mean, that's what you have to give up. You got to live in Alaska. But again, if money is what you're chasing, you may find a better deal elsewhere. If having a stable community where you can raise a family and have good schools and good environment, renting would be attractive. You know what I mean? So there's it's multifactorial in their decision making. And sometimes when you attract a new fellow finishing their specialty program, they want to come into a program that's well established, right? So they come in and say, okay, when am I going to start? Where's my patient going to come from? They don't understand that there's a lot of pent-up demand here. You come and your schedule going to be full come next week, right? But sometimes they need the mentor. Who's going to mentor? Even though they are qualified, board certified, have fellowship in their specialty, but they're still young. They still love to have another doctor or two in their clinic that can provide some mentorship and guidance and somebody to lean on, so they're not the only one in that specialty or in that clinic. So that also plays a role.
Is there an opportunity to bring a fellowship program to Shasta County?
Oh, yeah.
What would make sense? And do you have to have a university tied to a fellowship program, or could a hospital like Shasta Regional do that?
No, you could. I mean, more like you gotta have, of course, you gotta have a source of those residents that graduating that apply for fellowship. But yeah, any one of our hospitals in town can have a fellowship program, and something we're considering. But of course, you need the specialist because we have a fellowship program.
You have to have enough to kind of teach and mentor.
Exactly. Who's going to teach and mentor? And right. So we have the patients. We could have the technology. We could have the facilities. But do you have enough providers that can provide that fellowship training? And that's the key. If you only have one of a specialty, that one is not enough. You need multiple. Right. So the same thing when you bring different residency programs. Like if you want to bring a psych residency program, having a psychologist or on the team is not enough. You need multiple. You need an outpatient, inpatient, so that fellow is trained on both. You need pediatric as well as adult. So there's a lot of factors goes into it before you can make that come true. And that's what takes collaboration with the whole community to bring in a fellowship program or different residency program to town, because you need the specialist to help provide that mentorship and the training.
Gotcha. And so it's not something you can do overnight.
If it is, it would be a problem, right? I mean, we're not the only community that's really struggled with that, I mean, other communities also have similar challenges, especially rural areas. Right? They do have this problem.
Do you ever hear about either California politics or local politics being a factor in someone not coming to Shasta County or leaving Shasta County?
I mean, I haven't heard of it not coming because of it. I heard people leaving because of it. right? Because when they first come in, they're not as in tune, unless they're from the area.
Sure.
They're not in tune into too much about the politics
Right.
of the community until they get here and get exposed to it.
Right.
And then they see it and then they live it. And depending on what side of the spectrum you're in,
Sure.
you may either dive in and grow roots or say, that's not for me.
Right.
Unless somebody has really done their homework and studied the community way before they come here. Most, I don't want to say most, a lot of doctors don't look at that in the upfront.
Right.
They get it after.
Right.
They start feeling it, hearing it.
Right.
Right. And some of them get involved in the politics of things, and some others don't care. They go to the clinic, do their business, and go home. They don't care.
Yeah.
So it's a little bit of both. I mean, I just want to make sure that people understand from an ecosystem of the healthcare system, right? Shasta Community Medical Center plays an integral part of it. We must have two strong hospitals in this community. If either one of them is struggling or stop to exist, the whole North State would suffer. Not just Shasta County, not just Redding, the whole, because we got a lot of transfers from rural areas. And if neither one of us exist, that creates a problem.
Right.
Not only for the Redding area or the Shasta County, but all the North State. So it's very important for our community to understand that we need to support both facilities, not just one. And Shasta Regional Medical Center is not the hospital that was years ago. We have made a lot of changes in our leadership, changes in our physicians, changes in our staff, and the most important change in culture.
Right.
And if you look at who we are today, right, we're the only Leapfrog A hospital in Shasta County. And again, we spoke about the why it's important to get to hospitals that are been accredited or been rated A, or because of the quality outcome, a chance of survival is a lot higher when you are being taken care of hospitals that are well accredited and well rated. All those things make a difference in not only access to care, but timely access to care. And the capacity that we have, it's still untapped capacity. We should take advantage of it.
Yeah. Are there different levels of trauma centers between the two hospitals? I always hear Mercy is like a level 2 trauma center. Is Shasta Regional Medical Center have the same qualification, or what does it have?
We're not designated as a trauma center.
Okay.
But if you look at the number of trauma cases in the community, they are less than 1% of all ambulances.
I see.
Right. And that's another reason we should allow our trauma center to have more capacity to deal with those trauma when they come in. Because if they are already at capacity and requires a trauma, even though they're going to do everything they can in their power to attend to it as soon as possible and deal with it, and they do a great job at that. But if we balance the load, it makes both facilities stronger, have better quality. I mean, my philosophy, I don't compete with others, I compete with myself. I always tell my team, I want to be better tomorrow than I was today. And as long as we can move the bar every day,
1% better every day makes a big difference.
Make a big difference. And that's our key, because we are a community hospital and we're here to serve our community. And we made it clear the health of our community is our top priority at Shasta Regional Medical Center. And I would like to get this message to all our community. And I'm really available to meet and chat with anybody who can give us what gaps do we have, or they perceive we still have, what else we could do to improve and meet the need and the expectation of the community. We're human. We could always have room to improve. And no matter how good we are, we could do better. And that's our aim, to always do better and providing compassionate quality care to all our communities, whether it's in Redding or the surrounding counties. We're here to serve the whole North State. And that, to me, I would love to get this message across to anybody. And as I said, I'm available, me and my team, to really go out in the community and provide any services that they're looking for. That's what we need, is that collaboration, that dialogue between us and the community.
Yeah, it really takes everybody.
Absolutely.
To elevate the healthcare ecosystem up here.
Absolutely.
All right, so a day off in Redding for you, what does that look like? What is your ideal day in Redding when you're not working?
Oh, I could tell you there's a lot of things to do in Redding.
Yeah.
I could tell you, first thing I do, I go either jogging and walking on all those trails. River Trail is amazing. It's beautiful. I mean, it just You could just relax.
Yeah.
Just being there for a few minutes, it bring your stress level down, your anxiety down. You could just sit on one of those rocks and just look at the Sacramento River, watch all those birds coming in and out. It's $1 million scenery.
Yeah.
So I love it. You drive up to one of those lakes, one of those waterfalls that we have. It's amazing. My wife and I drove to Lassen the other day, and it's an amazing scenery there. You can just forget yourself. You can just sit there and stare at it.
Right.
Between the mist that's hit your face, the sound of the water hitting, it just, honestly, you can't buy that.
Yeah, that's great.
And we have it under our fingertips. Anytime we want it, within half an hour, an hour drive, you can get to areas where people pay thousands to get it.
Right.
And we're blessed to have it here in our community.
Yeah, we need to recruit those doctors that want to go to the lakes and the waterfalls and the rivers, not to Neiman Marcus, because we don't have that.
If this is their passion, I tell you, we got everybody beat.
Yeah.
We got everybody beat.
So where do you see Shasta County in 10 years, whether the healthcare ecosystem or more broadly speaking, where do you see Shasta County in 10 years?
One thing I hope that we don't lose our identity. Everybody wants to grow and turn us into this urban city. I think that would be a mistake if that's what we're aiming for. I think we should maintain what makes us who we are. We are focused on recreation, and that should be our focus, continue to be that. Growth is good if it comes in phases versus overnight. Bring all those big boxes in here and try to compete with the Bay Area and try to say, we have it here. I hope we don't go there, but I think the potential is great. We have a lot of resources, a lot of land. If we have a good strategic plan that systematically get us there, a strong foundation, because you don't want businesses to open and close.
Right.
Because that's the wrong message.
Right.
Anytime a business go out of business,
I know, I hate it. I hate it. It's the worst.
It's not the right message to tell the community, right? And we have to figure a way to attract the right people to Shasta County as a whole. But the potential is fantastic. And on all fronts, on the business side and on the healthcare side, there's a lot of needs, a lot of demand. Any group that comes to town will have a great growth and great success, not only professionally, but also financially, because the business is here.
Yeah.
You go to Southern California, open a new clinic, you're competing with so many others.
Sure.
It's
we're kind of on an island up here for sure.
It's more like an uphill battle.
Yeah.
We're here, hey, people would thank you for coming in.
Right, absolutely. Yeah.
People would shake their head for coming up here and setting shop here.
Yeah.
So I think the future is I have a positive outlook about the future of Shasta County and running overall, despite all what we're hearing outside, because there's a lot of untapped resources here.
The City Builders podcast is brought to you by Obsidian IT. Obsidian IT is a Reading-based, employee-owned technology company providing simple, scalable outsourced IT for your business. Discover how Obsidian cares about IT and give them a call at 530-242-6000 or obsidianit.com. Obsidian keeps us running at the chamber, and we could not do business without them.